Assalamualaikum warahmatullahi wabarakatuh and very good day to my honorable judges. My name is Associate Professor Dr. Milhan Nabil Ahmad Salimi. I'm from University Malaysia Police, UNIMAP. Today I'm going to talk about my innovation with the title of hydroxyapatite nanoparticles functionalized with catechin for therapeutic intervention of COVID-19. So I would like to start with coronavirus disease 2019 or COVID-19. COVID-19 is caused by severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. They are single-stranded envelope positive sense RNA viruses mostly infecting birds and mammals. COVID-19 affects the epithelial cells of the respiratory system and causes inflammation of the mucosal membrane. This led to alveolar damage and eventually pneumonia. Corona means crown, hence coronavirus refers to the spikes on the virus surface. Talking about the outbreak, the disease was first identified in Wuhan City, Hubei province of China in December 2019. The virus is thought to be originated from the bat and transmitted to humans by other sources. On March 11, 2020, the World Health Organization or WHO declared a pandemic due to its high rate of transmission and unavailability of specific vaccine or medication to treat it. Amongst the drugs being tested in clinical trials, hydroxychloroquine, favipiravir, remdesivir, and lopinavir or ritonavir have gathered a lot of attention. On the other hand, extract from natural products are a rich source of active compounds that can be used against coronavirus. Catechin, a polyphenol, has been documented to be a potential suppressor of viral entry and its application. Catechin is a natural flavanol, a type of natural phenol and antioxidant. It is mostly found in green tea leaves. It is FDA-approved herbal drug. So this is a chemical structure of catechin. There are at least 5 published articles in various journals reporting on the effectiveness of using catechin for the treatment of COVID-19. However, all experimental results were in silico, whereby it is by computational approaches. Here, molecular docking and binding affinity between catechin with S protein and S2 of the human cells are carried out. For myself, I have been using catechin for quite a while. I extracted it from Ficus deltoya or Mastrotec. Mastrotec leaves contain 80% of catechin. I use the catechin for my anti-cancer research, whereby it shows catechin can really kill the cancer cell by initializing the apoptosis process. In terms of toxicity, catechin doesn't bring any toxic effect, as indicated by the mice organs. Therefore, it is going to be safe to be taken by human. In order for catechin to be an effective drug for the treatment of COVID-19, catechin must bind to viral spike protein or S protein of coronavirus, as indicated by the A arrow, and also the cognate host cell receptor, angiotensin converting enzyme 2, as indicated by the B arrow. However, for catechin to be an effective drug for intervention of COVID-19, an excipient or drug carrier should be used. Hydroxyapatite nanoparticles are suitable for this purpose. Advantages of using hydroxyapatite nanoparticles. Firstly, it improves polarized stability. It improves biocompatibility, meaning that it's easily to be taken up by the human body and by the cell. And the most important thing is provide protection of catechin. Promote protection of catechin from degradation along the respiratory passageway. In terms of novelty, this is the first reported of encapsulation of catechin with hydroxyapatite nanoparticles for potential therapeutic intervention of COVID-19, as shown by the patent filing and also the copyright documents that I have. In terms of publication, I have published some quite good articles in reputable journals on hydroxyapatite nanoparticles as drug carriers and also catechin as anti-cancer and antiviral agent. In terms of commercial potential, this inorganic biomaterial complex has the potential for the therapeutic intervention of COVID-19 at the global level with high impact from the perspective of healthcare. Therefore, I'm doing cooperation with University Science Malaysia and the Clinical Research Centre at Hospital Tunku Fauziah for further COVID-19 treatment testing. Thank you for listening to my talk. I hope you all have a great day. Thank you once again.